we might have. I'll pause there for a moment. Are there any questions, Shefali? I think I see the chat box.
Yeah, there's none right now. We're doing good and people are telling us they can hear you, but there's no other questions at this time. Again, for all those who are on, feel free to enter your questions right into the questions box and I'll be keeping an eye on them. Otherwise, we'll keep going.
Okay, thanks. So some of the things to consider, as a leadership team, cultural, what is the culture of the organization? Is leadership involved? Or are they representing that they agree this is important to the organization? And perhaps instead of assigning this to a particular job and moving on to something else. So that would be an example of culture. And how do we want to do purchasing? And often the finance department can help with this. Should we centralize it? Should we let independent departments have full control? There's cases for both. I mentioned this before, being reactive versus proactive. Much better results if you plan ahead. Staff time. It doesn't make sense to get some help from the outside and have your staff work, focusing on the mission. An example that I'll give, probably bring it up again, is somebody in a department who's responsible for some clinical activity, some mission activity, but they're shopping for an item because they want to get the best price. And that's something that everybody gets excited about. Oh, I found this thing on sale, but they don't take into consideration the time that they put into shopping. So there's different ways to look at this and understand how you're maximizing value. Supplier relationships. Sacred suppliers often can cost you money in the long run. Board relationships, I'm not saying that's a bad thing, but I'm saying that if you use good business practices to make sure that those relationships aren't costing you a lot more money than really saving you or being the best opportunity for your organization, it all should be considered. I had a nonprofit who was scared to leave. We had an opportunity to change to save them over $50,000 a year. They were concerned because they received a donation from that supplier. And when we dug in some more, we found out that the donation was just a small amount compared to the savings. So you want to make sure that you understand all aspects of the money flow in these relationships. And also know that the suppliers aren't the bad guys, they aren't the vendor. The better you have those relationships with your suppliers, the better you understand each other, the more value they can bring you. And don't be afraid to ask for this better cost. Don't be afraid to ask them to analyze and compare pricing for you. They can do that. And outsource options. I talk about the opportunity to outsource. There's procurement consultants, there's contingency-based services. It happens to be a service that we partner with at the back office cooperative, where they'll do an RFP process for you and get paid on share of savings, so there's nothing out of your pocket. There's those types of services. Group buying organizations. It's one of the back office cooperative services, but there's many, there's lots of choices when it comes to group buying, and then just general consulting. Getting that kind of help might be worth it in the long run. Any questions there? Good.
Sorry, hang on one second. I was on mute.
That's okay.
Yeah, so far, no questions. Again, anybody who has any questions, I guess too, Linda, I'm sure you're going to address this, but, helping folks, depending on what their size budget is and sort of what kinds of options there are. I know you're going to address that at some point or dive into it, But I think that's probably a question that I'm sure people might have, is sort of what size budgets do you really need to sort of have, or how to gauge like when an outsourcing or group buy really makes sense. So maybe that's a good question to kind of dive into at some point.
I'm going to do that. Yeah. So this slide is a bit of a summary of things I've already said: getting outside assistant, use of group programs, procurement specialists, and just the whole idea of that ongoing best practices to not only reduce cost, but to maintain and not find that in a few years it's costing you more. So we are getting into the idea, another idea, and getting into the introduction to the back office cooperative. And then Shefali, I will talk about what smaller organizations, what smaller budgets can do themselves, and what opportunities there might be. Why collaborate? So why do this? Well, first of all, we want to work together on not just increasing the strength of one organization. We want to increase the financial strength of the whole community. We want to be able to focus on this particular community and the services they provide and the relationships they need. And by the way, this might get also into, you guys are outside Chicago, and there's often a concern, well, we want to buy local, we want to support our local community. So there's this perception that if they work with an organization that's not part of their community, like us or another group organization, that they're not complying with that, that goal among you to support your local community. And that's not necessarily true, because a lot of it is about business decisions, and there are areas of your cost that can very much be purchased through local businesses in providing that support. And then there's other costs that there may not be a local option, or the local option is so much more expensive that you might have a business decision to make. So again, if you had a conversation with us, for example, all those things should be discussed. What are the relationships? What donations are your suppliers giving you? What's yours? And I'll talk about this too, but what is your diversity commitment? And what is your commitment to your local community? Because if you don't talk about it and you assume that we don't understand that, then we're not able to dig in and help in these cost categories that do apply to you. We want to keep adding services. When there's a collaboration, there's the ability to add services that can apply to a lot of the organizations, maybe not everybody, but it helps the community at large. It also enables quality and service-oriented support. What do I mean by that? If we have this, and I'm working with Staples, for example, which I'm going to talk more about Staples, which applies to every organization. Staples is going to has the ability for the back office cooperative to work with higher level VPs and get responses to quality and support issues, because we've collectively are purchasing millions of dollars a year from them. Each small nonprofit might buy 1,000 a year, 500 a year, 10,000 a year. So we're able to provide them with the same attention that you would get as if corporation. And the collaboration has enabled more money for staff, services, and projects. So who are we? And the next few slides are about the back office cooperative, but Shefali, I will get into the specifics of what applies to this audience. This was started by a group of your peers out of Chicago. And there was some research done and they understood the power of creating scale. This idea that if you combine expenses, that you will be able to drive down cost. We now have, this was seven founding members, and we now have, I think we just last counted at 140 members. Why do you guys care about that? Well, the more that we get this community to collaborate, the more we can get more of the spend through our organization, the more negotiating strength we have. And in fact, after 5 years of doing this, we're going back to the table with Staples and we're going to get more cost reduction. So the notion that, well, we'll get an initial 20% savings, but what happens after that? If we collaborate, if we pay attention, and if we grow, and if we get organizations to get involved, then we're going to be able to, what I call the expression, continuous improvement. Again, it was founded in 2008 by that group of nonprofits, being able to get strength in negotiating and reduce cost. In 2014, there was new leadership and kind of a reinvention of the back office cooperative. And we were able to start adding not just group purchase plans, but expense management, consulting, and procurement services. That's the based procurement services that I explained, and there's expertise, industry expertise in many categories, way more categories than you need. Where are we today? And really, it's 2020 beyond. We have more group services, we have complementary assistance, and we have a commitment to supplier diversity. When we go to the table, who are minority businesses? If they're a bigger company, what is your commitment? We want to see your policy and know that you have a policy for supplier diversity, that you have a policy for employee diversity. And we're also, we had one session before COVID, we had a session to help the community with their own supplier diversity improvements, and we want to continue that education. So this is a list of our group programs, and so let me talk here a little bit about what applies to a smaller organization. Typically, accounting and bookkeeping, healthcare benefits, and the consumables with Staples are some of the more popular categories or group programs that our smaller nonprofits will inquire about. And I say inquire because sometimes it makes sense, sometimes it doesn't. Now, depending on what you do, what your services are, their medical billing may apply. Typically, energy for the smaller organization, the only reason it ends up not applying is that smaller organizations, especially in the city, and it might not be the case out where you are, they're leasing space, so they don't pay their own energy bills. So that could be, but it tends not to be. In the smaller organizations, food tends to be a group program for larger organizations that are making food for lunches, for dinners. It's with Cisco, and the issue for smaller organizations is either they don't have those kind of programs, or that the industry needs to be able to deliver a certain amount of food for every drop, what they call drops. And we just don't, each organization doesn't have enough scale for that when we're talking about budgets that are especially 5 million and less, or even 10 million and less. So, and we are in the midst of of negotiating for a new program that will provide assistance in payroll processing, HR information systems, PEO options, and that we are hoping to launch this fall. We're still in negotiations to tweak up the program. That is a program that would apply, that would have support for small organizations as well as large organizations. We've had a commitment since especially since 2014, to improve our services for the smaller nonprofits. So I'll repeat that accounting and bookkeeping, healthcare insurance, even copy. If you need one copier machine, we can help with that. And consumables with Staples, which is in red because I'm going to delve into that a little bit more. And then the payroll and HR will be able to support the smaller nonprofits. So the consumables with Staples, that is one program that has been extremely popular if you're teeny tiny or if you're very large. And I'm going to skip a slide here, sorry. When I first took this over in 2014, I thought of Staples as an office consumable company. But Staples stepped up and competes in the industry with, like Amazon, where they have grown their portfolio to almost any consumable that you might need. One of our members even inquired about buying cribs. So they have they have this kind of anything desk where they will see if they can get an item and get it at a good price for our members. So today's view of Staples is almost any kind of consumables you can think of. We went from let's see, I guess it's under the business essentials, sort of the basic office consumables, office supplies, and that's, again, that's what Staples was always known for, just being office supplies. And I even have been going back and educating the members that have been around since the beginning, because they didn't realize they had so much more opportunity with Staples. Break room supplies, Jan, San, and facility supplies. By the way, PPE, they have those supplies as well. Pack and ship, technology, furniture. In today's world, the technology has become popular because of being able to buy laptops at very good pricing. It's helping, we've helped organizations to get laptops to kids at home, to people working from home. Organizations have need to buy more or replace laptops so people could work at home. So we've really been working with Staples to make sure that organizations are getting the stuff they need in this crazy time that we're in. I will say, just like the rest of the industry back in May, June, there was some challenges with the supply chain for a lot of the PPE, but no different than any other company having those challenges. And Staples has worked hard on their supply chain and getting the products that our community is asking for. Just to go back a second, wherever that is. Nope, that's not back. This is just to say that we work with Staples and their very comprehensive account team. They have product specialists. They have relationship managers that are dedicated to just your organization. And we work with them regularly. We meet with them every other week, and we're making sure that our community, our members, are getting the support they need. I'll pause there, Shefali. I want to ask you if you feel that I've answered the question about smaller nonprofits, and see if there's any other questions.
I think you have to some extent, but what we're trying to figure out is sort of for the smaller organizations, is there, like, if their accounting expenses are pretty minimal, does it still make sense to sort of participate? You know, like I think maybe understanding what that threshold is in terms of size of budget, where some of these sort of outsourcing and group buys really makes more sense. You know, what is that threshold? I'm sure it's different maybe for accounting services than it might be for HR or things like that. So, you know, if a nonprofit is small enough and they only have 1 or 2 employees, does it make sense for them to outsource or even have a conversation with you guys about the HR, you know, group purchasing, the HR package you guys have or things like that? So I think that's where I'm trying to understand or help our audience understand, because I know we have a varied audience right now in terms of, you know, who's on the call and who isn't. So.
Yeah. Well, I have a bit of a biased opinion because there isn't a magic potion, Shefali, where it's like, okay, you're this size and you have this many employees, you should definitely look into it. It's not that black and white. So when I say I'm biased towards having a conversation. I'm biased towards getting some other perspectives about what do you do now, how do you do it, and we can get a sense of if we think it's worth dive to explore if there's improvement. So what we're asking is, do you have an appetite to have a 30-minute conversation? And you know, in 30 minutes, it can be, hey, there's nothing here to take a next step about, or there is some opportunity. Every organization there's a lot of sameness, but every single organization we talk to has unique situations. It could be, I have one organization who's struggling now because their finance manager is aging out and it's suddenly an issue. Do I replace that person? It turns out that they can probably outsource the job for a couple days a week at a lot less cost than the full-time person. You know, hiring another full-time person. So, but that's a unique situation. So I wish I could give you a cut and dry answer, but in this world of we should be uncovering every rock, we should be making sure we're doing all our due diligence, I always suggest a conversation. And it's a consultative conversation. It's not a selling conversation. And we can talk about whether there might be an opportunity or not.
Yep, that's fair. I hear you. And I just want to make sure you have a time check. It's about 9, almost coming on 9:40. So I want to make sure you have a chance to get through your slides and that we have a chance to have Q&A at the end.
Okay, I think I should be almost done. And I can get through this quickly because I tend to have already mentioned a lot of this. We have 140 members. We've all of our members together are a bit over 1.5 billion. We've grown over the last at least 6 years from about 3 million of managed spend to over 10 million of managed spend. And typically, on average, organizations save, and this may have, on average, it's a 20% savings. An organization sometimes comes in and we save them 8 to 10%. Sometimes it's 30 to 35%. On average, it's 20%. I don't think that's the only, the only measure, because there's ongoing good management and best practices. Complementary evaluations. So if it's a 30-minute discussion or even a 60-minute discussion, or if we take a deeper dive to do an analysis of your suppliers and what that looks like and what we see, that's a completely complementary evaluation. So again, we want to know the uniqueness of each organization and be able to talk with an organization whether there might be an opportunity or not. We're staffed to serve. If there's a problem with a supplier that you're using through one of our programs, then it's our problem too. And we want to help improve process efficiency and free up your staff time. This is the summary, a high-level summary. We have our complementary reviews. We have group programs. There's contingency-based procurement services and consulting. Once in a while, there is a consulting project necessary. And that's my presentation, Shafali. So hopefully I left plenty of time for any questions.
I think you did. I have a few more of my own. So can you
Okay.
give us an idea of like the buying power that the nonprofit sector kind of represents? You know, oftentimes as a sector, we're not viewed in the same way as, the private sector of business and companies and even small business. We're not, a lot of times people don't view nonprofits as small businesses, but we are in essence that, with a different tax status, right? So I think like just helping us to understand, what is our purchasing power? I'm sure you have sort of high level data around that, sort of what we represent as buyers, consumers ourselves.
Yes. So one piece of data, and one of the reasons why I got passionate about working with the nonprofit community, especially here in Chicago and Cook County, is just the mere size of it. Just Cook County alone is a $125 billion industry. Just Cook County. So
Wow.
take 15, 20% of that. That's the spend, right? Maybe even 30% because some organizations need more overhead. Now, in fairness, 125 billion includes healthcare. Okay? Healthcare is not part of our core business because they have other buying groups that they tend to use that are more focused on like medical supplies and some of the other items that are important for that type of industry, whereas we have a lot of focus on human and social service, and we've become pretty much experts in a core competency in the human and social service sector. So you get an idea of the scale. In the for-profit world, the idea of group programs is not new, and it tends to bubble up when a national association of, let's say, gas stations or whatever it is, a national association of something, they will tend to provide group buying for their members. There are, and like our healthcare program that we have also works with a lot of associations. In the nonprofit sector, I think some of the uniqueness comes from the fact that we have many small organizations and they don't tend to grow and merge with larger organizations. There's a phenomenon in the for-profit world where as industries grow and become more important to the world, they'll consolidate, they'll merge, and you'll end up with really in the long run economically 3 large organizations serving a community. And think about that in the cable industry, think about that in the energy industry. Think about that with your cell phones. There used to be, I don't know how many cell phone operators. Now you only have, 2, 3 choices. And so that is the common evolution of an industry. You don't see that in the nonprofit sector. Small nonprofits are starting up all the time for all the special needs in our community. And very often the social needs of our community are very, very much part of one town or one county. So it's just a different animal. And it makes a whole lot of sense if we're getting the communities on these back office expenses to collaborate and to take advantage of scale, where they're probably not going to grow and get it on their own.
Yeah, I hear you. Can I address a question that you talked about, or you mentioned sort of the suppliers that you are in relationships with or that you guys have secured. And you talked about sort of what we might feel out here in the DuPage western suburbs, like, this conflict of wanting to support local out here. What would it take for you? Like, let's say if I came to you and I said, hey, let's explore, back office cooperative, actually establishing supplier relationships with different sectors, whether it's accounting or HR or whatever, for the DuPage area. What would it take for you to sort of, really consider that? That's one question. And probably the other question that I have is really about these smaller organizations. If you are a small organization who has 1 or 2 employees full time, what is your advice on how that small organization can identify 10, 20, 30% savings sort of immediately? You know, what is your recommendation? Like, what are the areas you would encourage them to look at in terms of really achieving 10 to 20% savings or 25% savings?
Yeah. Again, it's not so black and white, Shefali, that it can happen that way. It's still a conversation. What to do? What to do is to have the willingness to talk to us. Let me ask questions. Who are you buying supplies from? Well, let me take a step back. What do you need? Tell me about your business. Do you clean floors in your business? Is your clients cleaning those floors, or do you have to hire somebody to do it? Do you hire an outside company? Do you have it? Isn't it somebody that's employed by you? You have 2 employees. What do those employees do? What is the nature of your business, and what are your types of expenses? Very often, office supplies, more times than not, or not just office supplies, but all the consumables that you can buy through Staples, tends to be a rich area for reducing costs. And we just want to understand, how are you buying them now? And would this be able to help you? So it's another thing is your insurance. Okay, who are you buying your insurance from? How long have you been buying? How long have you been using that broker? Do you hear from the broker a lot, or do you tend to just hear from the broker at the end of the year at renewal time? So there's nuances and situations that I want to ask about and converse about and understand where there might be those 20 to 30% savings opportunities.
Yeah, I hear you. What do you find in your experience, like with your members? Where are the areas that they tend to sort of really experience the savings? So in your 140 some odd members, where's the biggest sort of areas that you're able to help them today?
We are having success with our new medical billing program, if that's a service that people are providing, because not everybody does medical billing, as you guys know. Our office consumables, because of the fact that the product lines, I showed you this chart, because of the fact that the top left corner, Business Essentials, has now expanded across all of these product areas, our members have been saving a lot of money by going back to Staples and saying, please look at our Jan, San, and facility supply purchasing. And they've doubled their spend with Staples because they're moving their Jan, San purchasing to Staples. They saved 20 to 30% on those items, and they've been able to streamline and have a more efficient purchasing process by consolidating into the bigger one supplier. And they've been able to set up cost centers and manage the costs by programs. They've been able to set up oversight by a centralized, maybe it's the finance department, maybe it's the operations, but they've been able to provide more oversight into what's going on and not have a lot of getting rid of some rogue buying that tends to drive up costs. So that's been a big area. There is some savings with our copier. When you buy a copy machine here and there, the food, but again, the food tends to apply to larger organizations. We saved last year, one organization, $73,000 a year on their food purchasing.
Wow.
Yeah.
What are they? They were a food heavy organization?
They
like
are homeless. They work with homeless.
Yeah. That makes sense.
Yeah.
That's,
so they do have,
That's
and
huge.
Homelessness, rehabilitation, workforce, that all of that, and with the housing and the rehabilitation, they are providing food.
Okay. And then I didn't give you a chance to sort of answer the other question about developing some DuPage suppliers. Is that something that like you would consider doing if you felt like you were starting to get more members in a certain geographic region?
You know, I wouldn't ever say no, but it has to make business sense. And,
Sure.
you think of things like catering, or, we buy lunch for our office every week. And it's a great opportunity to buy local. And maybe there's a provider in your local area that would like to do a special price for your members. So that kind of thing, yes. If you're talking about some of the work in these larger, like nationally provided services, it gets a little harder.
I hear you.
So it's not just a no, it's a qualified yes, and open to understand more about what the community would want.
And then I have another question. Sorry, I know that others, no one else has chimed in with too many questions, so I figure I can ask all the ones I have in my head. So I know, like, obviously, D&I is very important right now, and it's at top of mind for all of us in the sector. Regardless of whether we are a BOC member, we're buying, group buying, or anything like that, what are some sort of advice or tips you have for all of us to really, how do we go about having a more inclusive supply chain, or just, I don't want to even call it supply chain. What if, just how do we go about being more intentional with just the people that we do business with and the folks that we hire? How do we seek out more inclusive choices?
Well, I'm not an expert in HR, so for employee diversity, I do suggest.
No, I don't mean with employee diversity. I mean, like, let's say I have to hire a photographer for an event. I mean, nowadays that seems like such a yesteryear concept in our world of virtual. Like, who's having in-person events? Nobody. But I think, like, just, how do we be more mindful or intentional about when we have purchasing power? Like that inclusiveness also means not just in HR and not just board representation, but also with how we buy. Like, do we buy from more, are we more inclusive in the buying that we're doing?
Yes. So be proactive. That's my biggest advice, be proactive. There are websites for minority and women-owned businesses that you can access. There's resources. If you're having trouble, call us, we'll help. We have access to organizations that are highly involved in this topic and can also help. But if you go to the websites and go to the resources that even our government has in listing women and minority-owned businesses, you want to include them in your request for pricing or your request for bid. The idea is you want to give everyone that you want inclusive an opportunity to come to the table. And that's step one. Step one is that many of these minority businesses and companies historically have not even had the opportunity to come to the table. And it's about us. It's about us doing a little extra homework to give them a chance to come to the table. Now, if their pricing is way out of line, or their services aren't exactly what you need, the next thing you can do is have an open and honest conversation with them and help them to do better for the next time they get to come to the table. So we want to be proactive in bringing those organizations to the table. We also want to be proactive in giving them feedback and helping them understand more and more about what this community needs so that they can do better to serve this community.
Yeah, that's a really good piece of advice. I think making sure that we communicate back if we don't select them, why not? But I think that's a very helpful point. I have one more question.
Yeah, sorry, Shefali, if I can just add, I'm going to go way back to what I said early in this conversation about not waiting till the last minute when you need something. So if you need a photographer, the more in advance you're going to need that, the better you can plan, the more opportunity you have to do some homework to bring minority businesses to the table.
Thank you. That's good. let me ask about in your list of services where you have the sort of accounting and HR and benefits, healthcare, other things. Have you explored some of those other soft skills, or not soft skills, the other skills that we need, like grant writing or social media marketing firms, like that kind of, like the kinds of things that we might be outsourcing for today? You know, a lot of nonprofit organizations don't have a grant writer on staff, but they outsource that particular position. So do you offer, have you looked at some of those other areas for a nonprofit?
Not formally at this point, because we are so far more involved in our core business is repetitive overhead expenses. But the big but is we connect with people. And if there is a need for something like that, and think of us as a source to get some names that you could add to the list to talk to. So we have a network of people we know, and if somebody said, Linda, do you know any grant writers? We'll go find out and help get some names.
Sure.
No matter what service it is.
Got it. Well, I'm going to go ahead and switch over to my screen so I can kind of show folks just sort of where we are. So I'm going to show my screen. I didn't see any other questions pop in. So if people have questions, they can still feel free to type those. I don't see any others that have added in, but I want to share with you guys, you know, where we are with Giving DuPage in terms of virtual programming. So this is what's on deck for us in September. On September 3rd, we will be hosting the first of our, I think we have about 10 classes with the NIU Civic Leadership Academy. The first class will be Crisis Communications. I do want you all to know that all of the NIU Civic Leadership Academy classes will be $30 they're all going to be virtual, but it's NIU charges for their classes. That's not dollars coming to Giving DuPage, but this is their course fees, and all of our courses for the rest of the year through June of next year will be, you know, depending on like whether they're a 2-hour class or longer. So this is the first one on September 3rd. September 16th, we are hosting a program for the nonprofit organizations, particularly those who serve low to moderate income households. Some of you are familiar with the Community Reinvestment Act, CRA, which applies to the banking industry and other financial institutions. Really, how can your nonprofit organization benefit from relationships, building relationships with bankers, and as such within the different you know, nonprofit, like what does that actually talk about? So we did this program a couple of years ago in 2016, and it was very popular. We had over 100 people attend that program. We just felt like it was important to revisit that topic, especially now, since there are so many nonprofit organizations in DuPage County serving low to moderate income households. On September 24th, we're going to be doing the flip side talk with the audience of banks and financial institutions, but not for this nonprofit sector audience. We are going to go into our board match program and how it works and how bankers and other finance people can really serve on nonprofit boards. For the executive directors who are on the line, we will be having our 3rd quarter executive director network program on September 29th. Please note that that is executive directors only. No other nonprofit staff, board members, or granting bodies can participate in the ED network. And on September 30th, we will be hosting again an audience for the faith-based community, but we had started a DuPage Interfaith Service Council, so we are going to be hosting those programs happening at that time. I think I have a couple of questions that came through, so I'm going to go ahead and the question that somebody has for you, Linda, is what is the box subscription? Does a nonprofit pay you, or based on the service that you're providing, or how does it work exactly?
There's only a membership dues if your size of your budget's greater than 5 million, then there's a nominal annual member dues. You're only paying for what you buy from the supplier that we're connecting you with.
So I want to make sure, does that answer the question that folks had, that someone had? I want to make sure that we covered that. Again, if you have any other questions, we do have about another minute or so. We'll just,
Yeah, and if I can get any feedback, since hasn't been a lot of questions, any feedback to let us know if this was helpful. My conversation with you was helpful or even not helpful. If you want to type that in, I would love that.
I appreciate that. Yes, folks, please feel free to type in. We won't be sharing who is providing the feedback, so please feel free to give that feedback to Linda. And I will be providing the recording as well as the presentation with Linda's permission and her contact information to all attendees afterwards, so you have it. And then just as a side note, Linda, I thought I hit the record button. I missed the first few minutes, so the recording won't be a complete one, but I do apologize for that. I really thought I hit the button, and I guess I didn't tap it quick enough, and thankfully I noticed it. But still, we did get one feedback saying thank you, this was useful, so that's good. Others feel free to chime in. I do know Linda is a presenter and she wants to make sure she provided you with useful information. And her contact information is available to you. I do know for a fact she would love to answer any questions, just be a resource, regardless of whether you become a BOC member or you use their services. I know that she's a fount of information, and she would welcome just supporting the sector in general.
Yeah.
So,
you have my contact information if there was something you were hoping to cover or something to learn about that I did not address. Please drop me a note.
yeah. With that, I don't think we have any other questions that are coming in. Again, Linda and I'll hang out for a minute or two so that you can feel free to definitely ask us any questions that you might have. But we're here, we're around. So if you have any questions, we'll hang out for a minute or two. But we just want to make sure that that people can see us, or people can ask us any questions if they have any. So thank you, Linda. I appreciate it. Thank you so much.
Thank you for this opportunity and your great hosting.
Well, I was almost close. I can't believe I made that little recording mistake, but I'm so sorry about that. Helpful information that provided a different viewpoint on how to look at this more as a business and a savings. So thank you for that piece of feedback. Thank you, guys. Appreciate it.
That's very helpful.
And Linda, do you have how many members? I know you are very Chicago focused, but how many do you, and are you guys, and I know you're a national organization, so it's not even that you just help, local organizations, you help some national ones too. How many folks do you have that sort of fall into that category?
Probably a handful that we have from around the country. We have the Denver Botanical Garden as a member. Yeah, so going national is newer to us, but so we're talking to people. Probably 90% of our membership is Northern Illinois.
Yeah, and I know there's other nonprofit buying cooperatives, right? Other
Yes.
organizations that do sort of what you do in other parts of the country. And I know co-op buying and group buying is very popular in the government sector. I know there's several large, huge co-ops on that side of things too, right?
Yes. Yes, government, industry by industry, like healthcare, for example, has a huge national what's called a GPO, group purchasing organization.
Yeah.
Okay.
Well, I think most folks have bounced out. I appreciate the folks that hung in. We'll go ahead and call Linda because I didn't see any other new questions that came in or comments or feedback that came in. We did get all the questions answered and shared whatever we had. I'm glad I came with a whole bevy of my own because I did have a lot of questions of my own, as it turns out. So
there were a lot of good questions, and we appreciate it very much.
Thank you. Linda, I'll follow up with you on email and different things, but to all who are still on, thank you so much for joining us. And thank you, Linda, for your time and your expertise today.
Thank you for this wonderful opportunity.
And everyone else, please be well and be safe until September's programs. See you guys.
Bye-bye.